Everybody is dealing with something. And that's really why I want to share these stories, because the more stories we tell, the more people can relate to them, and hopefully we can help, get through their own struggle.
Yeah, so it's super simple to do a podcast. You basically just need a couple of microphones and sit down and talk for a little while.
We really truly need to be understanding that showing up for your mental wellness is strength.
We're constantly publishing new content. Be sure to like, subscribe, and ring that notification bell.
So welcome to Tattoos of My Soul podcast. I am very excited to have Dr. Amelia Kelley join us today as our guest. I'm excited to have you because I have not had a mental health expert on the podcast yet. I've talked to a lot of people who have, dealt with their own mental health journey, their own struggles. Kind of our theme of the podcast is always talking to people who have been through something significant and how they have turned that struggle into a strength. But it'll be really awesome today to get your perspective, because you work one-on-one with people, various issues across the board. You specialize in trauma and ADHD, just to kind of give people a little bit of a run through of your just your expertise. And I've got it written down because you have a lot of things. Oh my God, I don't think I can remember all this.
I'm thrilled you could fit it on a Post-it.
Well, I wrote small because you have a really long list of expertise, which is impressive, but you're a licensed clinical mental health counselor. You are an art therapist. You are a yoga instructor. You're the founder of Kelley Counseling and Wellness. You are also an author. Your most recent book is Powered by ADHD, which I would love to just spend a couple of minutes talking about, because you really talk about how that can be a superpower and not necessarily a negative thing for people. And you also are getting ready to do a TED Talk, which
I know, I'm so excited.
Yes, that's awesome. So I know you're super busy, and I really just am appreciative of you taking the time to connect. We met, what was it, back in, I think, January.
Yeah, it feels like a while.
Yeah, it's
in a good way.
Quick, but yes, we met through a mutual friend. She was having a virtual event, and you and I were on the same segment basically together, and we're discussing. And then I came on your podcast, and now you're on mine. So I appreciate you taking time to come on and talk today.
Absolutely. I'm excited to be here, and I feel honored to be the first, as you were saying, mental health expert to be on here. Yeah. I mean, throw it at me. If you have any questions people have fielded your way or you've noticed in talks, I love thinking on my feet. So we can go for it.
Yes. Take just a minute to talk about your book, Powered by ADHD, because I think that's such an interesting topic, because typically we see ADHD as a very negative thing. And so that even just that title kind of grabs my attention. Just take a few minutes to explain what that is about and who that's for.
Sure. So I love that you did not say the subtitle, because it really can be for anyone. However, it is specially focused on women, the book. And reason being is that women have been underdiagnosed and understudied up until really the early 2000s. And our perspective about ADHD was kind of the quintessential hyperactive boy who the symptoms were really present and external. But what we're discovering is that in women especially, it can present as a very internalized experience, like racing thoughts, which equates to anxiety, or the brain fog that can happen, especially pairing it with the menstrual cycle, and how there can be these peaks and valleys with symptom presentation, and even how effective medications are depending on where you are in your cycle, and or if you're menopausal or postmenopausal or pregnant. Like there's so many, I mean, women, we have so many dynamics with our hormones. So the powered by aspect of it is that taking from some research on, I believe it was Tom Holmes had done some really great, I feel like I'm misquoting the author now, but the book was A Hunter in a Farmer's World, and it is looking at the fact that ADHD, in my opinion, and in the opinion of, I think, some newer researchers, is actually an adaptive genetic trait that is not something that needs to be fixed or eradicated or treated away, but rather learned about and managed in a way that allows the incredible strengths. I mean, there are some really, it's funny, I was talking to a very high powered professional I work with yesterday.
Mhm.
And she was talking about her current COO is just not thinking outside the box, not curious, not on their feet, like just isn't showing up in the way she wants. And she's contemplating letting them go and finding someone else. And as she's explaining what she's looking for, I warned her, I said, just a warning, what you're describing is someone with ADHD. Like, I think you actually want to hire someone with ADHD.
Wow.
So, and we kind of laughed about it. And I said, so if
Yeah.
that's the case, you might need to find some guardrails to help that person be successful.
Uh-huh.
Because people with ADHD actually statistically are more creative and think outside the box more for a variety of reasons. And that's just the tip of the iceberg of the strengths that I see in people I work with, in family,
Yeah.
and even in my own neurospice that I like to call it.
Yeah. That's so interesting. I think, I love how you're empowering basically
Hmm.
people that maybe suffer from these things, because you're so right. You're so like spot on, especially for women, because I think when you get into that midlife age, I'm going
Hmm.
on 43, and you start to feel things that you haven't felt before, physically, emotionally, mentally, and you can kind of
Hmm.
often wonder, like, why am I feeling this way? I don't feel
Yeah.
normal. I'm, like you said, the peaks and the valleys. I just want to
Hmm.
feel like consistently good. And I think, knowledge is power. And when we can understand ourselves and our bodies and our emotions and our hormones more, then we
Hmm.
can start to have a better quality of life, because we're like, okay, nothing's wrong. I need to understand that this is how I'm wired. Or,
Right.
I've had my mentor that I work with, I call her my mentor slash coach. The one of the last sessions I had with her, I asked her a question about kind of my thinking, and I was like, I just need to know, like, is this something that I'm always going to have to consistently work on? Or, like,
Hmm.
sometimes I feel like this particular area of my mental health is something that I just always have to be intentional with. And she goes, yeah, that's just kind of like how you're wired. And, she gave
Hmm.
me some information that I had not really thought of before. And it helped my perspective so much. It was like,
Hmm.
that's not something I need to fix necessarily. It's just something about my genetic makeup that I'm going to
Hmm.
always have to continue to put intention towards. And it just
Right.
completely shifted my perspective. So I just share that to say, like, when you can understand your
Hmm.
thinking and your brain and just everything about ourselves more, it can really
Hmm.
make a huge difference. Yeah.
Right. No, I like your perspective on that because it's kind of like not enmeshing yourself with whatever you have going on, whether it be anxiety, whether it be ADHD, whether it be
Hmm.
trauma.
Yeah.
It's like, this is something I'm experiencing. You can diffuse from it. You can, and when we diffuse from things, we see it. This is really
Hmm.
in line with acceptance and commitment therapy approaches where instead of being anxiety, we
Yes.
have anxiety or we're experiencing anxiety, just
Right.
as one example, so that it allows us to be in a much more self-compassionate tone and a much
Yeah.
more curious tone, which is really where we want to be when we're creating a lifestyle that works with our genetics and that works with our um neurology. It's funny, I had a friend send me a really funny video yesterday. I think it was yesterday actually, and it said something along the lines of it was talking about being on like a diet or something. I'm
Uh-huh.
not like pro diet culture. I'm just saying it was, that's what the meme was about. And then it said something along the lines of, I go to all these fitness classes and I do all these things, but then my genetics remind me that epigenetically I'm actually a refugee from like
Yeah.
from some area and I'm being chased by potato famine or something funny, like just
Yes.
really speaking to the point that even if you're not going through the thing right now, we are already just presented and born with this body that responds to our experiences in certain ways.
Right. Right.
Mhm.
Yeah. Makes total sense. So let's dive in. The first thing I really would love to get your perspective on, as a mental health expert,
Mhm.
is there is still, I feel like it's improved. I feel like it's gotten less, but there's still, even in 2025, there's still stigma around mental health. And it's still kind of this like topic that we don't necessarily want to talk about. I always say we'll talk about our IBS, we'll talk about our chronic fatigue, we'll talk about we need to lose weight, we'll talk about all these things physically. But when it comes to our mental health, our anxiety, our depression, our trauma, our PTSD, whatever it might be, we don't want to sometimes talk about that. Why do you think that is? And how can we get more past that? Like I said, we've made some strides, but there's still that stigma there.
I think there's a variety of reasons, and I think all of them could be addressed at once in a way. So I think first and foremost, just on a human basis, we struggle as humans when there's something that we can't see and something we can't place our finger on. And I mean, really, this points to things around faith, if you think about it too. Like sometimes people really saying, well, show me the proof. And that is, if you think about it, the way that mental health manifests, unless it's something that's so plainly obvious, like, I don't know, schizophrenia, for instance, is it's such a stark difference between someone who is and isn't, that I feel like in a way, we as people have almost said, oh, okay, well, yeah, that's mental illness. We need to address that. But what about the quiet mental illnesses, we'll say, the ones that get woven into high functioning anxiety, or the ones that get woven into, keeping it all together and showing up with a mask and a smile on your face. And I think those are the ones that, and it also reminds me too of how we treat autoimmune issues, where unless there's a blood test or something specific, anytime there's a syndrome, I think as people, we struggle to really feel comfortable around that. So I think the first thing is recognizing our desire as people to have control and have something we can put our fingers on, but having a bit of faith in the people who are having these experiences. I think that's something to consider. The second is when we really look at the landscape of mental health and how long this has been a science, it really has not been that long. I mean, I don't know if you've ever seen those old like Renaissance paintings where you have like the babies and the mothers and all the different figures from the Bible and all of this.
Yeah.
Have you ever noticed that the babies look like miniature adults?
Yes.
There's a reason for that.
Okay.
Because historically, people thought that children and babies were just small adults mentally. So even our artwork was showing our like narrow scope of mental health and the way that people think. So it's just these really odd things that show up in our history. When you think of PTSD, it wasn't until the 70s after the Vietnam War when anyone was even considering this. And then let alone someone who maybe, for instance, was, not a frontline worker, but didn't see action. They didn't even think, you weren't even allowed. Like the women nurses weren't even allowed in some of these meetings, these support meetings and these treatments, because you couldn't possibly have PTSD. So I think it's this constant evolution of, and how ironic that now that we can see inside the brain and we can do these scans and we can put our finger on it, that now we're saying, oh, okay. TBI, right?
Yeah,
it does
exactly.
exist. So I think there's these components about how we absorb information and make change as people. But then you've got this other side of it where it's what we consider strength versus weakness.
Yes. 100%.
Right. And I think that's probably you're like, yes, thank you, Dr. Kelley. That's where I was going. But when we consider the fact that we wouldn't look at someone who has diabetes and say, oh, you're weak because you have type 1 diabetes, for instance. I'll take it even further and say type 1, because someone who really, really can't even change lifestyle to change their diagnosis. They just have to take medication. We really, truly need to be understanding that vulnerability and showing up for your mental wellness is strength. Like that's the brave path. That's the thing that makes us courageous. And I actually love that you brought this up, because you had kind of in passing mentioned the TED Talk earlier. This is part of my intention of my talk, is surrounding an intervention that I think we can and should be doing in the schools that has been introduced, but it hasn't been really adopted in our country, but it has been in other countries, that will start putting mental wellness and well-being, eventually mental health, but on baby steps, trying to bring us in the way we can. We'll bring this in line with how we treat and assess physical health, especially in our children.
Yes.
So,
well, because they're 100% connected.
Yeah. Absolutely. Absolutely. This whole, the like mind body connection people say, I hope we phase out of that because I don't think we should even separate it at all.
Right. Right.
At all. And not just on an experiential level, but even neurologically. Our gut makes, I want to say, upwards of 90% of the serotonin.
Yes, we talk about this all the time.
Right.
In what we do, because we are treating people with all the nutritionals, nutritionally, obviously, and we have so many people that walk through our doors and they have gut issues. Yep. And at the same time, while their gut is suffering, they're also suffering up here. Yes. And it's like these things are connected, and we absolutely talk about that. Like if you are feeling low mood and brain fog and some depression, some anxiety symptoms, those kinds of things, the first thing that you need to do is not take a pill for this, but address this, address your gut. And people that are listening, I'm pointing to my gut when I say this.
Well, and going with what you're saying too, what I love about like the whole reason you're saying and all of that, the time is so hopeful because people sometimes I think, okay, if I start meditating, for instance, it can take, research shows, up to 3 weeks of consistent daily meditation to start seeing improvements and expansion in the frontal lobe, which is where our executive functioning lives mainly. Right. Food is different. And I know you know this. I think I want to say the research says as little as 3 days.
Yeah, to reset your gut.
To reset, but also to offset it. So we want to consider when I have my clients come back after Christmas. Goodness. Yeah, right. I mean, no one is feeling well because they've spent this, I call it the weekend of the year. They spent this like period of time treating their gut poorly, which I equate it when we think about mental health. It's kind of like driving cross country with dirty oil and, in the oil canister and no gas in the tank. It's not going to work.
Right. Right. Yeah. That's spot on. We could not be more aligned there. 100%. Yeah. So let's talk a little bit about, I'm glad that you said, like the mind body connection and kind of realizing how connected it is. And I 100% agree. I actually had a client come on it was probably last fall. And I had seen her for an extended period of time. And when she started coming in to see me, she had chronic debilitating anxiety. And we just implemented some daily habits and something like prayer, meditation, exercise. We reset her gut. We did the whole body approach, whole body mind approach.
Awesome.
And she, within 6 months, she made huge improvements. And so I said to her, will you come on and talk about your experience? Because people need to understand that this is something that a lot of people in our world today suffer from. It was really interesting. She had not had really any like trauma, so to speak. Nothing had really happened. It was just
big T trauma.
Yeah. It was just all of a sudden like this big wash of anxiety. Because I think a lot of people assume in order to have that kind of anxiety or to suffer in that way, you have to have gone through something really traumatic. And she really hadn't, life was just kind of going along. She was in her mid-20s and just boom, just this hit her and she didn't know how to deal with it. And so we had a really good discussion on a different, session that I did with her. And one of the things I wanted her to inform people about is just being okay to talk about your struggle. And like you said, it's not a weakness, it is a strength to talk about this. It is a strength to be informed. It's a strength to get the resources that you need to improve and all those things. So let's talk a little bit about like stress and anxiety, because these are words that get very loosely thrown around in our culture today. And we have so many things that come at all of us every single day that can really cause those things, you know? So what is the difference? How do you know if you're stressed, you're just like dealing with chronic stress, or you're really suffering from anxiety? Like, what's the difference there?
Well, I do think it's also good to determine the difference between stress and chronic stress also. So stress is actually necessary. We're bringing TED up again. One of my favorite TED Talks is The Upside of Stress. I believe it's Kelly McGonigal maybe that did that one. And she talks, and I completely agree about the idea that, you know, we need stress to get us going. You know, we need stress to, people really bash cortisol, but when we think about it, certain levels of cortisol, I mean, if you do a really heavy, intense workout, you increase cortisol in your body. Right. So there is a purpose for it because it keeps us active and it keeps us engaged. You know, when we're on a podcast, we probably have more cortisol in our body. Even not much because you're lovely and I know you well, but you know, we probably have more cortisol in our body than we do if maybe we're laying on the couch watching Netflix. So we need some stress. And actually, the way you perceive stress has an impact on your immune system.
Okay.
So if you see stress as useful, if you see a purpose to it, you actually change the response of your body and you can function and effectively use those hormones more proactively.
Okay.
Whereas if you feel a victim to your stress, if you feel like stress is coming at you and you don't have any power, and this is where that internal versus external locus of control comes up, where if I see something that's stressing me, I was about to go into all these examples, but I won't go there. But if I see something that's causing me stress and I see, okay, this is just a signal that I care about this thing and that I need to either work harder or find something else out or find an alternative route, it can motivate action. Whereas chronic stress, to me, when something becomes chronic, it's no longer necessarily a message our brain needs. And so when we think about if you stub your toe, you're going to get acute pain sent to your brain. But let's say you have, you know, an achy shoulder from using the mouse too long or something like that, or an old injury. And you're getting this chronic signal to the brain to inflame and protect that area of the body because of an old injury or because of a trauma. That, to me, when something becomes chronic, is not necessarily useful. And so that's when it slides into the stress is no longer necessarily useful. Now, when we think of the difference with anxiety, okay, again, we all have anxiety. Things can make us feel anxious. To me, anxiety manifests as like a flip in my stomach. Like I really feel it in my stomach when I'm anxious.
That's the first place that I always find it.
Yeah, me too. Yep. I'm like taking a deep breath just thinking about it.
Like, okay, now I feel anxious just thinking about it. Yeah.
And yeah, you know, I could conjure an image of something to almost make that happen. Like that's how powerful, especially if you're a highly sensitive person, which I've talked with you about. That's how powerfully we can feel anxiety.
Right.
The problem is that a lot of practitioners out there and a lot of pop psychology is giving this idea that you can get rid of anxiety and you can just cope it away and medicate it away, when in fact, just like stress, some level of anxiety is normal. When it becomes problematic is when it starts to pull you away from being able to engage in your life in an effective way.
Yes.
Right. And that's usually when whatever intervention someone wants or needs, whether they're going natural, whether they want to go for medication, I support their journey. I don't prescribe, but you know, I'm going to be on their journey with them. I will sometimes ask them if they have the structure, the lifestyle, the ability to use whatever that skill is that's going to actually attend to the anxiety. And if they aren't capable of doing those things, to me, that's when it's more disordered, if that makes sense.
Yeah, that makes total sense. That's really interesting. I want to go back to like what you said about the stress changing, because I'm like sitting here thinking like, okay, I'm gonna start doing like,
Yeah, for sure.
changing the way you perceive
Yep.
stress. You said something, not being a victim to your stress, but seeing it as an indicator that, okay, maybe I just need to adjust or modify, or, you know, this stress is actually good because it's going to motivate me to take action. I think that our society has kind of made stress like a bad word, you know?
Right.
And so the minute that we feel it, we feel like something's wrong. But there is that balance and that differentiation between, you know, a little bit of stress, like you said, is healthy and needed. And one of the things that I've worked on with myself, because based on my history and my past, and even before my trauma that I experienced, I've just been like, I think I'm just kind of predispositioned to be more of an anxious person. And I've really developed some tools in my tool belt over the years to manage that. But you're right. It's not something that just the flip of a switch, like, oh, if I do this certain technique or this certain strategy, it just goes away forever. I think it becomes more manageable and more dialed in. But one of the things that I've trained my brain to see when I have stress, or particularly anxiety, when I feel that feeling in my stomach or whatever, is instead of getting more anxious about the anxiety itself, because that seems to be a bit of a cycle, you know, we get anxious about our anxiety.
Right.
Is just seeing that as an indicator that, hey, okay, my body is responding right now physiologically to whatever's going on in my brain, but that's an indicator to use a tool. So whether that's prayer really works for me, meditation, breath work, or exercise, if I'm able to, you know, go get a workout or in, been using that as kind of like the indicator that I just need to pivot.
I love that, because if you think about it, not only can we see stress and anxiety and that pit in your stomach as an indicator, but we can even get a little greedy and manipulative with our stress if we want. Because if you're listening and you're thinking, okay, you ladies are telling me to feel positive about my stress, but I don't feel positive about my stress, so this isn't going to work for me. That's fine. You can completely not believe in this, but you can trick it. You can almost say, okay, I don't believe this, but I'm going to tell myself this is what it is. I'm going to say, okay, this anxiety is going to be something that works for me, or this stress is going to, like, it's a different energy. It's not, I believe it. It's, I'm just going to tell myself this is what's happening. And to your point about the flip of the switch, I do think it's important for people to remember the impact of neuroplasticity, right? That what fires together wires together. So if your typical MO when you're stressed is to scroll or snack or complain or clench your jaw, those pathways, like a groove in a record, are really strong. So if you're saying, you know what, I'm going to start deep breathing when I'm stressed, and you do it once and you do it twice, and then you're thinking, well, why is this just not my natural thing that I do? Why is this not fixing everything? It takes time to reinforce those pathways. So don't give up. Like, if it's something you're deciding, this is going to be my new response when I'm feeling this way, you need repetition to really make it kind of hold, if that makes sense.
100%. I love that you brought up neuroplasticity. It is literally one of the things I talk about the most. I think it's fascinating. First of all, I love that our brain has the ability to change in structure and function
forever, our whole life.
Yeah, based on the experience that we give it. Because I think if people really truly understand what neuroplasticity is, they realize that they have a lot more control over the way their brain functions than maybe they, you know, initially thought. So yes, absolutely. Let's talk a little bit about, so I'm going to jump from anxiety, stress, to trauma, because again, this is another word that we throw around loosely when it comes to mental health, mental wellness. What exactly, as a mental health expert, what is your definition of trauma and how does that look different for people?
So trauma, and it's interesting because earlier I had thrown in casually that term big T trauma. So
Mm-hmm.
trauma
Yes.
really at its core is anything that pulls us out of our normal method or way of functioning. Quite simply, it can be something that simple.
Okay.
What makes something traumatizing or
Mhm.
potentially something that leads to things like post-traumatic stress disorder is when we don't have the capability. There's a couple of things at play here. First of all, we don't have the capability to complete a trauma cycle. So Peter Levine, who I was so honored to have on my podcast, he created somatic experiencing therapy, and he talks about the trauma cycle where when we like if you think of standing on a diving board, right? And you're looking down at the water and you're feeling, your heart rate's going up, you're getting a little freaked out, and you jump.
Yeah.
That, when you jump, is actually trauma. Like you are in the air, you are at
Mm-hmm.
risk. And this is even
Okay.
for divers who are professionals. You slice through the water. Now you can't breathe. You're underwater
Mm-hmm.
and your body is still in trauma. But you rise and you shoot up out of the water, you take a big breath, and you remind your nervous system, I'm safe.
Yeah.
That's a full trauma cycle. When we look at the way that Dr. Levine was looking at this, when you look at animals, when they become traumatized, they actually physiologically shake after in order to move the trauma throughout their body.
Okay.
But they don't have these really intense, robust frontal cortexes like we do, where we don't shake. Actually, I have done that before because I've learned about this. I almost got in a
Mm-hmm.
car accident once, and when I'm sitting there frozen, I was frozen in the car thinking, oh my gosh, I
Yeah.
could have been killed. Suddenly I remembered all of this stuff I'm talking about now. I must have looked crazy. I was in my car, I let go of my steering wheel, I started shaking my hands, and I just started
Mm-hmm.
screaming. And I did it to kind of
Yeah.
move the
Release.
stress through,
Yeah.
release.
Yeah.
Exactly.
Release. Yeah.
Exactly. A lot of us don't have that opportunity to release, run, complete the trauma cycle, empower, or act. When you
Yeah.
think about a child, for instance, who doesn't have a choice, or someone who is in an abusive relationship, or a natural disaster, there's all these
Mm-hmm.
things that happen that are completely outside of our control. And
Mm-hmm.
that's where it can be a big component as to how someone ends up with PTSD. And it also makes a big impact as to if they have these resilience patterns after,
Mm-hmm.
people to ask for support from. The ability and the internal dialogue, we were talking earlier about how
Right.
vulnerability is strength. Part of resilience is asking for help. Part of
Mm-hmm.
resilience is knowing I need a break or I need a moment.
Right.
So to simplify all this, though, I will say I kind of went to the end of the punchline before the beginning. There is this easy way that we describe trauma sometimes where we say big T versus little t trauma.
Mm-hmm.
I think it oversimplifies it, but it is helpful. So I will say big T trauma is usually what we imagine the big scaries like abuse, assault, what you experienced,
Mm-hmm. Mm-hmm.
natural disasters, war, famine, things like this are considered big T trauma. Little t traumas can actually be, like I was saying earlier, anytime we're pulled out of the norm of our body, our nervous system.
Mm-hmm.
So moving, being
Mm-hmm.
fired from a job,
Yeah.
um, having a falling out with a friend, and this is complex. I'm oversimplifying by saying having a falling
Mm-hmm.
out with a friend. But these things, especially over time, can be like death by a thousand paper cuts.
Yes.
And that's where things like complex trauma also come from. So I think to say that that woman you were talking about earlier hadn't
Mm-hmm.
experienced trauma potentially,
Mm-hmm.
maybe she can't identify or put her finger on like a big T trauma. But I do think a lot of people minimize their trauma too. Maybe they
Mm-hmm.
had a parent who ignored them sometimes, or maybe, like maybe they didn't feel like their feelings were heard. Maybe they were picked on at school. Like these things can be these little paper cuts that add up.
Yeah. And then it just all kind of manifests itself and comes out in
Mm-hmm.
this physical form. That makes total
Mm-hmm.
sense.
Mm-hmm.
When you say trauma cycle,
Mm-hmm.
can you explain that a little bit? and what that looks like, because you said you kind of have to get through the full completion of the cycle.
Right. So, similarly, a story that Levine had brought up in his book on this topic, he was talking about this really wild study about these children and a bus driver who had been kidnapped and put in, just disclaimer, trigger warning, it ends up fine. Put into essentially like a living tomb. They were in this massive cave, trapped. The wild thing was what happened was that the children who partnered up with the bus driver and were able to dig a hole to get everyone out, longitudinally, all of these kids were studied. This kind of study would never happen nowadays, but I'm grateful for this study. The kids who were able to physically mobilize and do something to get them out down the road had better markers for mental wellness, and some of them didn't even have PTSD symptoms.
Okay.
The children who were not mobilized, who did not have any part in completing the trauma cycle, most of them had severe PTSD symptoms.
Okay. So it's almost like you get kind of stuck, so to speak.
Right. You can get stuck because your nervous system, your body, your mind, your heart, your spirit, all of these things didn't get to, like I said, come up out of the water and rise and save yourself and pull yourself out of this. So that inability to empower and protect and guard and do something, mobilize, that's why we look at things like the fires that happen out in LA, for example, where everyone mobilized, like people were getting up. And I even think about the hurricane that happened here in North Carolina. When we come together and we mobilize and we do things to help each other, and to, whether it be, donating, whether it be whatever you do, that's part of our trauma cycle.
Yes. That makes total sense to me. So I'm selfishly sitting here thinking about my own situation.
That makes sense.
Yes, because
it's not selfish. It's relatable.
Yeah, I'm like just personal, like, because I'm thinking, we experienced a big T trauma, as you call it,
you did.
shooting in 2020, and then a couple of months after that, COVID hit.
Yes.
And so it was like isolation and I didn't go to therapy. I actually canceled therapy, because we were on lockdown.
Right.
And so I didn't realize that that's what was happening, but the trauma cycle was not completed. And that's why almost a year later, everything capitulated again. Now it's spilled into the marriage and all these things. And that is when we started doing the individual work. My husband and I did, obviously marriage counseling and all those things. And then all of the business that we created, that's actually part of the trauma cycle. And that was why I think now I understand, like, clinically, this is why our companies and the work that we're doing has been so purposeful and healing for us, is because it's helping to complete that cycle. It's like, this bad thing happened, but now let's go mobilize, as you said, let's do something good with it. So
I love that you brought that up.
Yeah,
I love that so much,
connecting the dots.
Yeah, and you're talking about trauma integration, which is the idea that taking something we've gone through and creating some form of meaning. And it doesn't necessarily mean that you have to go out and start a business or a blog or write a book. It can also mean, now that I've gone through this trauma, I know what I know now, and I can show up for a friend, or I can protect myself in future relationships by noticing red flags. These things are forms of integrating the knowledge that we learn from trauma. And I don't want to say this like in a toxic positivity way where, oh, it all happened for a reason. And I'm not, I'm saying like, there can literally be a reason that you manifest and that you create that, in a way, is like completing the trauma cycle that you didn't have a chance to complete before. And I think this is very important when I work with a lot of folks, a lot of my clients, where we'll do things like EMDR, where we do these idealized parent scenarios. Maybe you had an abusive parent, and we will do a full EMDR session around, like, what would the ideal parent say? What would the ideal parent do to show up? And some people will say, well, what's the point? I don't have the ideal parent. But not only is this reinforcing neural networks, it's also opening up the perspective of someone of what maybe they deserved, or maybe showing up and reparenting the inner child, or there's all these ways to continue the cycle to its completion with semicolon. I do want to say, you do sometimes have to complete it again and again. So just because you're thinking, well, I did that really cool collage about my trauma and I cried in a group and it felt completed. Like that doesn't mean that it's not going to show up again. That doesn't mean that, especially if you have children, for instance, as they maybe reach the ages that you might have been, not you, but just anyone listening, that someone might have been when they experience trauma, it could come back up and you'll have to recomplete it. So that's where I've been asked before, can you heal from trauma? I think you can experience healing. I think to say you can eradicate, heal it like a cut that just heals without a scar, I think it disrespects the trauma. I think in a way it minimizes
that's
it.
It's always gonna be with you.
It informs your life. Yeah.
Right. Like again, going back to what we went through, I mean, when that happened, like my physical, like my whole being changed. It will never go back to the way it was before.
Of course.
And I even notice, and I've done a lot of work. Like I've done EDMR, I've done, acupuncture, I've done all like an intense talk therapy. I've done all kinds of different things. And even with all that work, and I still do it, I see somebody about once a month. I still can feel triggered, so to speak, or activated when certain things happen. Like we were just watching a show the other night, and like there were gunshots on the show, and I felt myself like tighten a little bit. But now, and I'm glad that because you've been bringing up the self narrative or the inner dialogue that we all have. Now, the way that I talk to myself when I start to feel those things is completely different than it was 4 or 5 years ago, because I understand, okay, this is what my body does. My body thinks it's in danger, but it's really not, and like that's just from an experience that I had, and then you change the way that you talk to yourself essentially, and then that kind of helps you just get through that anxious moment or that triggered moment, whatever you want to call it. Yeah.
Absolutely. And I mean, really what you're talking about is the power of self-compassion, because when we look at a critical tone where there's this kind of old coach mentality that if I just bully myself into thinking something, I'll feel better and do better. When in reality, that part of our brain actually cuts off creativity. And the self-compassionate tone, the more curious tone, the kind of like, I'm going to show up and not criticize the process, but be curious about the process. That activates the parts of the brain that are more curious and creative. And when we think creatively, that's where we come up with ideas of how to cope, or that's when we are able to be more empathic, because we can think, oh, maybe this is why I'm feeling this way, or this person is feeling this way. So that's why it's it's so important. It's not just, it's great to be your own cheerleader. It's actually neurologically beneficial to you to be self-compassionate.
Yeah, I think you and I talked about the last time that we had a discussion, toxic resilience, which is a term that I have read a little bit about, and I can't remember the author that coined that term right off the top of my head right now, but I thought it was so interesting because it's basically kind of what you're talking about, where we recognize, hey, I am feeling these things and it's okay, and what do I need to do to cope, or allow myself some rest right now, some like mental rest, because we all think that we need to just keep pushing through. Like if I'm stressed, if I'm anxious, whatever, it's not a big deal. Everybody is. But in fact, those are indicators back to, hey, what do I need to do? How do I need to adjust right now? What are the tools that I need to implement that can help me navigate through this situation better in a more healthier way? Does that make sense what I'm saying?
Oh yeah, absolutely. It kind of is like this race to healing. Like,
Yeah.
people think that it's, and I've had clients that come in who are doing trauma work and
Mhm.
they're like, I want to do the trauma work. I want to do EMDR. I want to do brain spotting. I want to do the things like, let's go, let's go.
Because we just want to be better or feel better. Yeah.
Right. And I will remind them and I explore with them, well, right now we're doing it. Like just being in
Mhm.
relationship and just being with, just getting to the point where you can feel comfortable and safe in the presence of another person is so
Mhm.
healing for your even, your biological makeup, but also your
Yeah.
stories and your narratives about life and about being well and safe. I mean, just right
Right.
there, that's even just listening to this conversation, hopefully, is bringing people
Mhm.
towards, a measured healing, not a race towards healing.
Right. Well, and I think also too, we have to understand that typically there's a lot of layers there. Like,
Mm-hmm.
and you're
Mm-hmm.
not going to get to that deepest layer on day
Mm-hmm.
one. You know, that
Right.
that is a process. I've learned that personally myself with my own journey, and then just working with coaching clients. You know, sometimes
Mm-hmm.
you are going through this process of trying to understand yourself more, and something comes out that you didn't even realize was there, or you thought you were
Mm-hmm.
over it, you know, and it's like, wow, okay, there's some more work to be done.
Mm-hmm.
And I use the analogy a lot of the times, and I'm guessing you'll understand, it's a lot like, or I'm guessing you'll agree, not understand. I'm guessing you'll agree.
That's
It's
okay. I
a
don't understand everything. I always love learning.
yeah, it's
You're
a
like, I
lot
think you'll
like,
get
I'm
it.
pretty sure you'll get it. Yes. It's a lot like exercising, working
Love
out. So
exercise.
if we say, hey, I want to be stronger, I want to have more endurance, I want to be more physically fit, we're not just going to go to the gym for 1 month and be like, okay,
No.
I'm good. You know,
Right.
it's a lifelong commitment. It's a lifelong process. We're going to show up
Mm-hmm.
3, 4, 5 times a week. It's
Mm-hmm.
really the same with our mental health.
Oh,
um,
right. It's a
we
daily
have to
decision.
continue. It
Mm-hmm.
is. It's a choice. It's a
Mm-hmm.
choice how you talk to yourself. It's a choice how you cope. It's a choice what you learn and understand and the
Mm-hmm.
resources that you get. All of this is a
Mm-hmm.
choice that you have to continue to plug into and implement.
Right. I couldn't agree
Yeah.
more. And I mean, if you really think about it's, I once had a client say, gosh, why do I have to do so many coping skills?
Yeah.
And I
Yeah.
said, well, really, it's to your point, it's a choice about what way you want to live. I mean,
Mhm.
it might feel and seem simpler to, again, love Netflix, but it might be, simpler and easier to binge TV and ignore fitness and ignore the things that you want to do. But is the aftermath of that really easier? Or is it
Right.
kind of that in the moment thing? And when you were
Yes.
talking about exercise, I sometimes give people the metaphor like, would you brush your teeth once a month?
Right. Hopefully not.
That'd be gross.
Yes. Yeah.
To me, and this is, I'm not saying this is recommended fitness wise, but for me, I encourage people I work with and myself to move every day. And
Hmm.
now that doesn't mean I need to be doing a high intensity interval training every day, but
Right.
every day, I didn't get to exercise yesterday the way I would like. I was way too busy, but I banged out like 20 push-ups in my office in between clients.
Yeah.
I jumped around. I did squats while I was dictating notes, like just anything to kind of like keep the energy flowing. And
Yeah.
that's really what I feel like it comes down to is if you're not moving, what are you doing instead?
Right. Well, and what you're talking about now is strategy. So you've
Mm.
recognized that when I move, I
Mm-hmm.
feel better physically, mentally, emotionally. So, hey, like you said, I didn't have time to get in my 45-minute workout, but I've got 5 minutes. So, should I sit and scroll on Instagram or do 20 push-ups? You know, what's going to
Mm-hmm.
make me feel
Right.
the best for the remainder
Right.
of the day?
And
And
sometimes
that's
scrolling does.
sometimes I'm not bashing scrolling because we all do it, right? You know,
Sometimes just laying on
sometimes
the couch and scrolling does help, but
exactly. But it's that strategic thinking. So
right, for sure.
let's because now I think we're kind of talking about habits, and I think that's the perfect question to end on. Um in your expertise, are there any small daily habits, someone who's listening to this and maybe they're
Hmm.
identifying with stress, anxiety, PTSD, trauma, or all of the above, and they're
Mm-hmm.
like, I would really like to take a step towards feeling better mentally.
Mm-hmm.
Are there any daily habits that you would recommend or suggest? Just somebody kind of taking a step forward towards that.
Right, for sure. So we were talking about neuroplasticity and having your nervous system do something typically when you're under stress. That's why daily breath practices while you're getting used to it is really important. I don't have to tell myself to do it anymore. My body is so sensitive to being depleted of good breathing that I can feel it. So if someone's not used to that, just setting an alarm a couple times a day for just a minute, practicing, whether it be box breathing, 4-6-8 breathing, therapeutic sigh, which Dr. Huberman talks about, like all of these different, there's so many different styles. Find one you like. That's number one. Number two, as I was mentioning before, some form of movement every day, whether it's a walk, whether it's gardening, whether it's actual formal exercise, whether it's dancing in the kitchen with your kids, just asking, did I move my body? Because it really is crucial for moving any stagnant energy, tension, stress. And if you didn't move your body and say it's the end of the day and you're thinking, oh no, I didn't do it. Gentle yoga or stretching, just anything that's intentional for your body, because our body stores all of this.
Right.
The third one is, I mean, I think as a highly sensitive person, this is very important to me. I think this really does equate to everyone in a different way. Try to create something every day. Okay. And it doesn't have to be, again, a chapter of your book or a blog or a master, like it could literally be create a moment. It could be create something you actually want to create. So maybe it's a beautiful meal. Maybe it's, I don't know, a painting you've been slowly working on. For me, creativity, it taps into that self-compassion, and it also makes sure we're being playful. Because play is something that a lot of people did not get enough of if they had traumatic childhoods. And play is also something that a lot of adults don't do enough of.
Oh, yeah.
And so when you say play every day, a lot of adults are thinking, what? So if you say create every day, I feel like that's like a really nice, kind of bridge. If it is fitting, I would say set a boundary or express yourself every day. But that doesn't always, I don't want you to feel like you have to go be like, kind of nasty to the cashier just for fun. But
to express myself today. So,
and let me say, but boundaries are, I don't see boundaries as a nasty thing. I think they're actually quite a compassionate thing for you and your relationship. But checking in, is there something on my mind today that I need to share with someone that I haven't been sharing, or something that's bothering me? So that might look like, for some people, they might need to journal or just check in mentally, whatever works for you. I'm not great at journaling unless I'm stressed. Like I almost have to be under stress to want to do it. But some people are really great at it. So
I'm going to send you my journal.
Oh, okay.
Because I created a journal, so I'm going to send it to you. Maybe it'll help you. Yeah,
okay.
It's a guided
I'll check
system.
it out.
So there we go.
Nice. I'll check it out, and then I'll talk all about it.
There you go.
But I think that's the last thing I would say.
Yeah.
Whatever comes easiest to you, a regular practice of anything on a regular basis is so affirming and grounding and comforting. So if you just heard me say all of these things and you're thinking that is too much in one day, just pick one.
Just pick one. Yeah.
Just pick one, the one that appeals to you most, whether it's breath work, whether it's movement, whether it's creation, whether it's sharing your feelings. It's great to do those things every day, but if you just pick one a day, you're on a good track.
Yeah, I love that. Yeah, and it's very aligned with the things I say too. So yeah, okay.
Awesome.
I know I'm on the right page.
You are.
Yeah, I love that. Well, thank you so much. I feel like there's so many other topics that we could talk about. And I just really appreciate your knowledge and your expertise. If people want to find you, follow you, reach out to you, get in touch with you, what's the best way?
So I'm pretty active on Instagram. It's just under my name, Dr. Amelia Kelley, and that's Kelley with an EY. My website is ameliakelly.com and it is under construction. You can go there. It's still my old site, but I'm so excited about my site like re-popping out into the world at the end of July. There's going to be a lot of awesome things on it. Also my podcast, which you were on, The Sensitivity Doctor. I have lots of awesome guests like you. But on my site, they can find things like I have insight timer meditations. I have a wellness channel on YouTube. Like I've got lots of stuff out there. You can just, if you go to my website, you can find all of it.
Lots of really good resources. Yes.
Thank you.
Yes. All right. Well, I'll look forward to another episode with you again.
Yeah, would love to.
Thank you for your time. All right.
Absolutely. You're welcome. Bye, everyone.
We're constantly publishing new content. Be sure to like, subscribe, and ring that notification bell.